Just explain to me a bit like what pain you're feeling at the neck.
Yeah, so like it's pretty much on my left side right now, and it kind of goes down towards my shoulder.
Okay.
Yeah.
Any other pain anywhere else at the neck?
No, just basically that, yeah.
And was there a specific event that caused it?
Many
Or?
events.
Okay, just give me like one of them. Just...
Concussions, I've had a few.
Okay,
Yeah.
so usually with concussions we see like kind of like a whiplash, right? Well, actually there is a whiplash with every concussion. So the neck flexors are usually something we find shut off.
Right.
So we'll actually we'll do your range of motion of the neck. We'll see what pinches, what hurts, and then we'll test some perturbation, which means we'll see if there's stability at the neck flexors, and then we'll treat you, and we'll see if there's a difference afterwards. So go through all the ranges of motion with your neck, up and down. Just tell me if you're feeling any pinching or
a bit along the left side,
on the traps, and if you look up.
Yeah, but close, like more on the spine itself.
Okay, so there's some compression at the vertebrae, maybe a bit. Do a side bend, each side.
Stretch.
I don't mind as much. Looking each side.
This one's okay.
So we do have a bit of limited rotation.
And this one I don't like.
Pinches?
Yeah, at the end at the left side.
Okay. Stand up for me. We'll just try a perturbation test. We'll just see if am I able to push you backwards here. So 1, 2, 3, and you're just gonna push forward. Push, push, push. So I shouldn't be able to push you back like that, right? Was there any pain with that?
No.
Okay. Line your back for me. So we know the neck flexors aren't stabilizing for you in a standing position. Some of the reflex points that we find for the neck flexors are going to be here at the pec. So just tell me if this is sore.
Yeah.
So we're just going to do a release. So we're going into like the pec muscle, the fascia, especially under the collarbone. And we're just finding anything that's like any adhesions or like muscle knots, and we're just feeling the tissue, seeing what needs to be released in what direction, what depth. And just breathe through it. You tell me if it's too much.
We're good.
Okay. And this is going to be part of your homework as well, you know, to release these areas. Just going to check the other side.
This side's worse.
Yeah. So you can feel it. Yeah. We'll go back in a standing position.
Yeah.
1, 2, 3. Push forward. So we're still seeing some weakness. Now we're gonna see if the pinching in the back of the neck that you were feeling is causing the rest of like that weakness. So go into seated position. So we have like C5, C6, that's sensitive. Right there?
Yeah, right there.
Here too?
Yeah.
Here too?
Yeah.
Here too?
Yeah, that's better, yeah.
Here's fine?
Yeah, right side's generally better.
Yeah, so usually when we push into the tissue, there's usually, and it causes pain or discomfort, usually there's some inflammation in there. So we do want to circulate that inflammation out. So we will use the pressure wave or the shock wave machine. If we see that there are some ligaments on tension, like in this case, right here, we'll use the shock wave almost like, think of it as like an ironing out a piece of clothing. And like if the clothing has wrinkles on it, right, the wrinkles are almost like the muscle knots that we feel in those ligaments in that tissue. So let's give you this one. So this is how shockwave would work. You bring the head down. So we put the muscle on a stretch. We'll just tilt a bit more this way. Just tell me if this bothers you.
No.
No? Anything here?
I mean, I feel it, but it doesn't bother me.
What's the pain out of 10?
I would say like 2, 3.
2, 3?
Yeah.
So usually when those sound waves hit inflammation or those muscle knots, it'll cause discomfort on the person. So 2, 3 is good. Usually we say like, 5, not more. If not, we'll reduce the intensity. But those sound waves are just, think of it as, that's it, like as an iron, kind of flattening out, smoothing out the tissue. You're gonna bring your head down for me. Sensitive here. So we're just gonna release here. Tell me if there's anything on this side.
I feel it.
You're gonna bring your head up and down. So flex down, yeah, go up and then flex down all the way, as much as you can. Okay, keep doing that. And I'm gonna bring your head down a bit further. You okay?
Yeah.
Let's retry the standing test. Okay. Just see if that's better. 1, 2, 3, push forward. Push, push, push. So I'm not able to push you backwards, which is good. But anyways, that's like an example of like, we're trying to reactivate the neck flexors so that you have more stability when standing, right? Because if not, then all these areas are gonna overwork, right? And you had a compression at the back.